Misuse of Prescription Drugs by Jessica Carbone, California State University, Long Beach. According to the National Institute on Drug Abuse, the term misuse of prescription drugs may refer to one of three things: taking a prescription drug differently than as instructed by a physician, taking someone else's medication, or taking a prescription drug for recreational purposes. The National Institute on Drug Abuse has also highlighted the three most commonly misused prescription drugs, starting with opiates, also known as pain medications such as Norco, central nervous system depressants such as Xanax, and stimulant medications such as Adderall. So how do opioids work? These medications tell your brain to block the pain and make you feel happy and calm. However, effects of these medications can be as minor as sleepiness or as serious as lung and heart infections. CNA depressants, on the other hand, increase GABA chemicals to slow down brain activity. This can have an effect on your body by causing disorientation, lack of coordination, and may also lead to serious accidents or injuries. The stimulant medications increase dopamine in the brain. This neurotransmitter plays a major role in reward-motivated behavior. This can cause anxiety, depression, and serious health issues such as increased blood pressure, breathing, and heart rate. So why is prescription drug misuse relevant to public health? According to a study conducted by the American Public Health Association, it's estimated that about 10% of the American population has engaged in the misuse of prescription drugs. Potential consequences of misuse of prescription drugs could be as serious as death, organ damage, overdose, addiction, complications of pre-existing conditions, and the legal implications such as jail time. So who's at risk of engaging in prescription drug misuse? Unfortunately, everyone is, but according to the Centers for Disease Control and Prevention, students as well as elderly people with chronic conditions are a higher risk. Risk factors for prescription drug misuse can include having easy access to such drugs, mental health conditions such as anxiety or depression, access to healthcare, pre-existing conditions, low socioeconomic background, and peer pressure. According to the Ohio State Medical Board, red flags of prescription drug misuse may include appearing impaired or really sedated, referring to drugs by their street names, traveling a long distance to see a doctor, sharing medications with friends and family, refusing drug tests, and losing prescriptions constantly. So what can you do to reduce the risk and prevent prescription drug misuse? Talk to your doctor and ask all your questions. Know your resources and learn about the medications that you're taking. Learn how to cope with peer pressure, get treated for pre-existing conditions, and make sure to lock away your prescription medication. If you want more information about prescription drug misuse, abuse, and how to prevent this, the Center for Disease Control and Prevention has a lot of reliable information on their website, as well as the Food and Drug Administration may be a good resource to find more information about your prescription drugs and know also your local health department and additional resources.